Hey everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Knee to Know Show, we're going to talk about nausea and vomiting after knee replacement surgery. What are some of the causes and what can you do to manage it effectively? If you're interested in all things related to knee replacement surgery, prehab, rehab, recovery, exercises, and much more, be sure to hit that subscribe button and turn on the notifications so you can catch all of our latest videos. So first of all, what can be the cause of nausea and vomiting after knee replacement surgery? Probably the biggest risk or the biggest cause would be the anesthesia that you receive during the surgery itself. For some people, this factor tends to subside, and the nausea from the anesthesia tends to subside, usually within a couple hours or by the end of that day, but it can persist. Some other causes are opioids or pain medicine that you're receiving or taking, or other medications that you may be taking. Sometimes just the pain in general from the surgery and the recovery, and just the feeling of discomfort and pain and stiffness can cause some nausea and vomiting. So this is a very prevalent thing. It's not uncommon to have this. There's one study that showed a third of patients who undergo any type of surgery have some nausea, have some vomiting after the surgery. Some people even may rate this as worse initially than the actual pain of the surgery itself. And that might be hard to imagine when you hear about the significant amounts of pain and discomfort that are possible after surgery, especially early on, but the nausea can be significant as well. So the best thing is really looking at medications, so both prophylactically, so it's a really good idea to talk about with your doctor, with your surgeon before surgery, especially if you have had surgery where you've had nausea afterwards, or you have a history of getting nausea and vomiting relatively easily or with different things, and you may get some prophylactic medicine to take. Or after the case, you can have different medications and treatments to help manage nausea and vomiting that comes on after the surgery. One of the most common medications is Zofran. You might have heard of before. That's a common medication to help manage nausea and vomiting. So besides taking medication and talking to your surgeon, if you do experience some nausea, if you do experience some vomiting after surgery, it's best to kind of just lay low. So lie down, relax, try not to do any type of rapid, vigorous movements or activities. Try to eat, try to take some fluids, but take sips, take small bites. Gatorade, sometimes soda, the carbonation can be helpful. Trying to just take small bites of food, saltine crackers, toast, things like that. And if you really find that your nausea is out of control and tends to last, then it's really important to reach out to your doctor, reach out to your surgeon's office so that they can help you manage this effectively. There can be some negative consequences, some really, some issues with your stomach and your digestive system, some issues with dehydration, malnutrition, things like that. So be sure to reach out to your doctor if you are not able to manage the nausea and vomiting, and if it doesn't pass, within a reasonable time limit. Thank you very much for watching. Again, be sure to hit that subscribe button and turn on the notifications if you're interested in all things knee replacement surgery. And as always, please leave your comments and questions below, and I'll be sure to respond. Thank you.